And welcome back. If you're just tuning in, you're watching the Arthritis Show. Joining us today exclusively in our studio is Dr. David Sontag. Dr. Sontag, welcome aboard. How are you doing?
Nice to meet you.
Thank you for coming.
Quite welcome.
Dr. Sontag, tell us about your practice here in South Florida.
Well, my practice is in North Miami Beach, and I've been practicing for 15 years. I've been 8 years at that location, and I see a large variety of patients, general practitioner, but I do see a large amount of patients with knee pain.
Perfect. So part of your practice, you deal with arthritis, and you do see a lot of knee pain.
Right.
And that is something that I commonly get to see. And that's one of the most common joints that is involved typically in our practice.
That's the most common joint I see as well.
Okay. And this person with the email that I read the email, she's a 65-year-old female who's been diagnosed with bone-on-bone arthritis, and she's asking if we have any other alternative. Obviously, most of the patients do not know about alternative or integrative medicine, and the whole purpose is here is to shed light on that. So I think this person may benefit from some acupuncture. What's your thoughts on that?
Well, she would benefit from acupuncture. She would benefit as long as she came. Once you reach the bone-on-bone stage, you're really at a quite advanced stage. And my experience with those patients is that as long as they come in for treatment, their life becomes much more tolerable. Yes, they're more comfortable, able to perform their activities of daily living without too much discomfort. But it requires ongoing treatment, and for a lot of people, that is not a viable situation.
Of course. What about as far as the basically, let's say this person come to you and having knee pain and doesn't want to get a knee replacement because whether she's too young or she has some sort of chronic condition that is not good to go under anesthesia, such as congestive heart failure and all that. What would be your initial evaluation on this person?
Well, my initial evaluation would be basically to ask them the level of their pain on a scale of 1 to 10. I do a full medical workup in terms of Oriental medicine. In other words, I do a tongue diagnosis. I might take a pulse. And at that point, I would do a physical examination and see what their knee looks like. You know, is it hot to the touch? Is it cool to the touch? That will change the treatment.
That would change your treatment?
That will change the treatment.
In what sense, Doc?
Well, if it's heat, if there's heat there, I have to use different points than if there's no heat. So we want to reduce the heat, the redness. That would be different.
If there's heat and redness, usually that's a sign of inflammation,
Correct.
Strong inflammation going on. So you have to use different type of needle, different points.
Different points, not different needles. The basic treatment is 4 needles placed under the kneecap. And it's relatively painless. And then some distance points or distal points depending. So if there was heat, then I would use like liver 3, which is down by your big toe.
Got it. And how soon do patients usually see some relief?
See results?
Yeah.
Right away.
Perfect.
After the first treatment.
And that's the good thing about the acupuncture. It's a non-invasive procedure. It's relatively simple side effects.
No side effects.
No
for
side
most
effects
part.
at all?
Well, you know, occasionally you'll get a person who has an acupoint that bleeds or gets a little inflamed, but I don't see much of that.
Right, but most people, they go home without any side effects. And
they go home with less pain.
Roman Garcia, do you have any questions?
Yes,
comments?
Doctor, when you perform these treatments, in your opinion, what is the biological mechanism that is created in the system that results in these benefits to the patient?
Well, I'm smiling because the question everybody asks is, how does acupuncture work?
Exactly.
And there's a number of theories about that, but the one that I like is you put in a needle, you cause a micro lesion, right? Mm-hmm. You're causing a little cut, all right? Tiny, very tiny. But the body sends healing resources to that area, and it really can't tell the difference between the cut and everything else that's going on around there. So in other words, the body might be ignoring that area because it's chronic. You know, it's sort of like under the radar. But you stick the needles in and you put a stimulus in, a signal. It's really a signal to the body. Pay attention to me here. And voila, we get pain relief.
So it's very similar to how a cell will respond to mechanical loads in basically in an environment where, for example, in arthritis, one of the leading causes of an arthritic condition is abnormal stresses. It's basically a signal to the cell. So basically what you're saying is that when you do acupuncture, you're actually providing a positive, a beneficial signal to the body itself.
To the body, to the nervous system.
To the nervous system.
You can even see on many acupoints, if you do a scan, you can even see parts of the brain light up. So it has a lot of, how shall I say, there's a lot of ways to explain it. It generates endorphins, that's another thing it does. So, but in Chinese medicine, in Oriental medicine, we talk about yin and yang and the flow of qi. So we don't tend to explain it biologically.
I understand.
All right.
You explain it through basically energy currents in the human body.
Right.
That theoretically exist.
Right.
Where if these currents or these routes, they become obstructed, then you'll have a concurrent problem in a particular region depending on where the route
Correct.
affects.
Right. It might affect a particular meridian. That's what we call the channels of the body in acupuncture. And the meridian can get what we call, say, for instance, blood stagnation. Blood stagnation would cause intense pain. Now, it's not quite what we think about in terms of blood in Western medicine, but it's enough to say that it causes intense pain, and I see a lot of that, especially with knee pain.
Fascinating.
Well, the way I describe it to my patients, they want to know what acupuncture is, and it's a simple explanation. I tell them, look, if you put a needle on the tip of your finger, you make the area bleed. And essentially that's what's going to happen when you do the acupuncture. You put a needle in there, you twist it around, you're causing micro-bleeding and hopefully stimulating the area. And I've had acupuncture done to myself, and I felt it was very effective treating some old hip pain injury. So I'm a big advocate of it, and I really wanted to thank you for coming, and we would love to have you back on the show. You definitely have a vast knowledge.
Anytime. It's
Perfect.
my pleasure.
Perfect. Thank you again for coming.
Thank you so much.
All right. We're going to take a break at this point. When we come back, Dr. Paula Bromberg will be joining us. Dr. Paula Bromberg is a psychologist here in South Florida. Let's go for a break.